Right, thank you, Richard. Good morning, everybody. Welcome to our public board in November. We just want to remind everybody that the meeting is being recorded so that we can make it accessible and available to colleagues to see afterwards. And I just want to also welcome governors who are observing us today. I know there's a couple of people with us, so really good to know that you're observing the board today. I also wanted to welcome Simba. Simba's been with us, I think, at the board before, I think when she came to as part of a patient story, but she's shadowing Jean, I believe, and welcome Simba to our board meeting as part of that development programme, which is the developing aspirant nursing leaders, I think, which is really great programme. I also just wanted to mention that this is Maria's last board, I can't actually see Maria on screen, but that's just it's quite hard to see a lot of people on screen at one point anyway, but I just wanted to mention that, and we'll no doubt take the opportunity to thank her at the end of the meeting. We have got some apologies for absence. Saqib Ali, our non-executive director, is absent today. And we also have, I think Linda is Director of Nursing, and Trudy Martin, Director of Workforce. David Williams will be joining us, but is on other business at the moment, so but David will be joining us later. And of course we have people, our ward manager at Wheatfield and patients sort of and service user with us today, but we'll do the introductions for that when we get to that point. So welcome to everybody. Let's make a start on the sort of the core items of business. Just check with everybody first. Have we got any declarations of interest for items on the agenda over and above the normal register of interest? Okay, I'll take that as a no. We have then item 4 is the minutes of our previous meeting. Can I just check whether there are any points of accuracy? First and foremost, please raise your hand if there are. If not, I'll take that as an accurate set of minutes for our meeting in public in September, and the board will approve those minutes. Are there any matters arising that aren't covered on the action sheet that anyone wants to raise from the minutes? Okay, I'll take that as a no. Then looking at the action sheet, I think this one, FT 2289, this is just about the quality and safety work plan, and we've had it on here for a little while. But I think I know, certainly in talking to Julia and Richard, that the work plan is sort of like being refreshed, but I don't know what the timeline is for that. Richard?
Thanks, Christy. Yes, we can pick this up in part under the Board and Committee Effectiveness Review item later on, but just to confirm that we're planning to have a refreshed work plan for QNS presented to the next committee meeting in December.
Okay. So I wonder whether we can just confirm through the assurance report that that's been done rather than keep this action open on the board. But if we could sort of delegate that back to the committee to report to us through the assurance report that it's actually reviewed that and undertaken that action. Is that okay? And Julia, are you comfortable with that? Great, thank you. And I think that's the only outstanding action, so we can close that off. Okay, now there is just one other thing I just wanted to refer to, and that's paper C, which is the Board of Directors annual forward plan. I don't think I think everything that is due for November schedule is on our agenda today. I think the only thing I did want to mention, and we might want to pick this up as part of the freedom to speak up item, is a conversation I had with Richard in the agenda planning session we did, was whether we would benefit from doing a freedom to speak up annual report, which would be a bigger item than necessarily the two reports, with the sort of assurance, because we have the assurance coming from the Quality and Safety Committee, I believe, on a regular basis, whether a sort of more comprehensive annual report might be a useful way of positioning the freedom to speak up, where obviously we would have the Guardian, Beth, present as well for that. So just a thought, and Dave, maybe we can, I know you're covering that item when we get to that, so perhaps we can pick that up as part of that and see what people think, but I'll just pose that question for now, and we can come back to that as we get to the item. Was there anything else on the forward plan that people wanted to comment on or raise? Okay, well, we'll note that, and then delighted to move on then to our patient story for today. And without any further ado, I'll invite Jean Knight, our Chief Operating Officer, to introduce this story. Thank you, Jean.
Thanks very much, Christy, and huge thanks to both Dave and to Kenley, who is our service user, for joining us today. So Dave is, as you said, the ward manager for Wheatfield, and I just wanted to offer my huge thanks to Kenley because he's been absolutely instrumental in a number of co-production projects on Wheatfield, including non-smoking status and a photography project. So really, really happy that you're able to join us today, Kenley, and to share your story. So I think everybody's more interested in hearing from him than from me. So I'm going to hand over to Dave and Kenley. Thank you.
Do you want me to go first?
You can go first.
No, because my stuff's boring, so I'll just tell them a little bit about the ward.
All right.
And then we'll go for you, because yours
Yeah.
are far more interesting than me. Hi, I'm Dave Rogers. I'm ward manager on Wheatfield. I have Kenley with me. Kenley can introduce himself in a minute. I also have in the room, I have Jan Lovelock, who's the service manager for secured services, who's just observing this morning. For those, most of you will be aware, Wheatfield is a low secure 12-bedded male mental illness and personality disorder unit on the Berrywood Hospital site. The service is commissioned through the Impact Provider Collaborative for secured services across the East Midlands patch, and we take gentlemen of working age into conditions of low security from the whole of the East Midlands. That's Leicestershire, Nottinghamshire, Northamptonshire, Lincolnshire and Derbyshire. We have an average length of stay of around 2 years, although that has extended I'm pretty confident as a result of the struggles of the last couple of years related to the pandemic. As I say, it's a very, very typical low secure service. We take patients stepping down from medium secure. We take patients coming to us from prisons, and we take patients stepping up to low secure from PICUs and other open units. We have a full MDT. We have psychology, occupational therapy. We have our own social worker. And I can see a little picture of our responsible clinician sitting there on my screen as well, which is Dr. Matumbike. Enough, unless you have any questions about Wheatfield. I'm sure you're much more interested, as am I, to hear Kenley's perspective on his stay here.
Yeah.
So, Kenley.
All right. Well, good morning, everyone. Yeah, I was in hospital for about 7 years. So what happened was, so the day before my release from prison, I was sectioned. I was sent to Berrywood, and I was to be honest, I was very angry because I thought I was getting out of prison like in a day, and like literally the next day, and then I ended up in here, where I didn't really, yeah, I wasn't too happy to be locked up, but yeah, and then I ran away loads of times, and you know, they did another assessment on me, and after 1 year and 3 months, I was then sent to another ward to deal with my personality disorder, which is emotionally unstable personality disorder. And then I was there for about 1 year, 9 months. Got in a few fights there with staff and patients. I got sent to a medium secure, St Andrews on the Billing Road. I was there for 3 years. Then I moved back to Berrywood, and then I got released last Thursday. It's been a long journey, but I appreciate the help that was given, like, during the whole time, because obviously I wouldn't have been able to get where I am now if it wasn't for that. But you guys probably want to know about you know, what I enjoyed of being in hospital. But one of the things that was good was that it taught me skills that I didn't have before, like cooking skills and just being able to function while being sober. You know, I enjoy sober activities now. Like when I was in the community, it was all about where's I need to get some drugs and I need to be high. But now I can, you know, wake up and not have that urge to, you know, go and take a spliff or whatever. I can just do something normal, like watch TV or read a book or something. So yeah, but like there's a lot of activities to do in hospital, but I don't feel like there's enough focus on reality in the community. Like there are many groups where you will literally just walk around the grounds twice. It's not helping anyone. Like people might say, oh, it's exercise, but you're not even raising your heart rate to lose any weight. It's a pointless activity. Like some people end up in hospital for a long time, but I think there should be a reminder of, like, you know, how much rent's gonna be and how much your food shop's gonna be, and you know, how much a car's going to be and how much, and you know, you need your provisional and you need to do your driving lessons and stuff like that. And it would be good if, like, maybe there was some more educational material, like on the ward. Like we've got a PlayStation 5, but it would be good if there's a library, but the books are outdated. I think we need to focus on teaching on, like, you know, like teaching people new, like important things, you know. So I don't know what all those things should be, but you know, like for instance, I've got my flat, and because normally people move on to Meadowbank to get taught these skills, but I think it would just be good if they learnt these skills even before they went to Meadowbank, so it's like ingrained, because it's important. I mean, like, there's a group called Current Affairs where we read the newspaper, and I think that's a good group. But maybe there could be another one of those and another, you know, I don't know what to say.
Kenley, I think you've hit the nail on the head with regards to community prep,
Mm.
and you're right. Meadowbank do a lot more. I'm very conscious that you were the driver yourself when you were here,
Yeah.
for a lot of the input that you've talked about, that it wasn't something that we routinely provided as part of our therapeutic program. But you were in a position, as an assertive man, you were in a position to tell us what you felt your needs were, and I think it was our duty to adapt to that. And I think the things that you're saying to the meeting here now are lessons that we've kind of learned from you. Not everybody from here goes to Meadowbank. Not everybody from here goes to another service. Some people like yourself step straight out into the community. So, you know, this
thing is, we've got the same facilities of Meadowbank. Maybe maybe there's not a point of maybe Meadowbank is needed actually, but
Don't be saying that. You'll have Elizabeth come chasing you down.
Nah, I just think it's I don't know. I don't know.
Kelly, what do you think with regards to the groups and the therapy and the input? You said that you learned some skills.
Some skills, but I'm not being funny, right? Like one of the groups is like cleaning a pair of trainers with like a toothbrush, or smelling essential oils, or you know, playing darts, and it's like it's not an after. I'm not in an after school club. I want to learn something.
Yeah,
I want to learn a skill. I want to get some qualifications behind. Because while I was here, I actually I went out of my way and I did a distance learning course with Northampton College, and I just think the lads need to do something like that instead of wasting their time doing silly things like, you know, washing their trainers. That's not going to get them anywhere. But I think it'd be good if, like, if it was on a timetable, then it would push them instead of them doing it themselves out of their own back, because some of them are a bit lazy. So, you guys know what I'm saying.
Kenny, we absolutely do. I think we've heard your message loud and clear, and thank you so much for sharing that with us. I suspect, Kenny, would it be okay if people asked any questions? Is that all right? There might be some colleagues that have heard from you and heard from Dave, and think might be interested to just ask you some questions. Is that okay from your point of view?
Yeah, that's fine.
Yeah, okay. I'll just open it up in case anybody does want to ask anything, and then I'll obviously bring maybe Dave and Jean back in just to sort of say what we think we can do in response to some of Kennedy's feedback. Angela.
Thanks, Krishni, and thanks, Kenley and David. I think I just wanted to say thank you for sharing your story. Takes a lot of courage to share your story in a board, so we really do appreciate it. It means a lot that you've taken the time to connect with us in that way. Really pleased to hear about your release discharge as well, because that I know is incredible, and I know that is also really important for staff and you know, I know Itai in particular in supporting the unit and yourself. So that's really important to hear about. But really value the feedback. I think it's fantastic that you've said what you've said, because I think there's a lot for us to reflect on. And as you say, we don't get everything right at all, and the feedback really matters. So I think our commitment is absolutely to understand what more we can do from what your experience has been, and that link with Meadowbank is really important, because as you said, David, not everybody does go to Meadowbank, so we do need to really think more, and materials like books and things I'm sure we can improve without a doubt quite quickly. So those sorts of things I just want to give your commitment, our commitment to acting on your feedback. Thank you very much.
Thank you. Thank you, Angela. Is there anyone else who wants to clarify anything? I can't see any. Oh, Julia.
Julia.
Thanks, Krishni. Thanks, Krishni. Hello, Kenley. My name's Julia. I'm one of the non-exec directors. And again, echo what Angela said. Thank you so much for sharing that. It is very brave to come and talk to a screen full of an awful lot of people that you don't know. So thank you very much. And I think we never learn until we hear from people directly, you know, what we're providing and what helps you. And I just wondered, what things made the biggest difference to you? Because I know there are lots of things that sounds as though we can change quite quickly, but what actually made the biggest difference while you were in with us? What things really worked and made the difference for you?
Well, the staff are nice, like nice people. So if I ever wanted a conversation that without having to talk to the lads, I could just talk to any staff. And they'd listen. The food from the trolleys, nice.
You're the first person who's ever said that, Kenley.
No, it's all right actually. Yeah. The lounge and the bedrooms are comfortable, I guess. They are. But I used to stay in bed till like 4 in the afternoon. Because the bed was comfortable. So yeah, I don't know. I'm not saying that everything was bad. I'm just saying we just need to focus on, you know, education and stuff. Because the world's in a bad place, you know, and we need people to be strong so we can help towards the cause, you know.
Yeah. Thank you, Kenley. That's great. I mean, I think I know Itai wants to come in, so Itai, there's obviously some, you know, Kenley feels strongly about sort of having preparation for life, I think is sort of what I'm hearing really, and making sure that the things, the activities are contributing to that. So any perspective you want to offer on that, Itai?
Yeah, yes, I do. And before I do that, Krishna, I first of all want to thank Kenley for, you know, agreeing to come and talk to us today. I think it's been a long journey for him. We've had many of conversations where we've spoken about this very thing about preparation for life. What I did really admire about Kenley, you know, during his time on Wheatfield was you know, his desire to, you know, gain vocational skills. It was really motivated. And I think it's important to note that we have got people in, you know, varying degrees of, you know, their mental health difficulties and varying diagnoses and, you know, varied levels of motivation to do you know, some of these things and to gain some of these life skills. In fact, I think one of the challenges we faced was, you know, trying to get Kenley employment in warehouse work, which is what he was very interested in doing. And you know, there's unfortunately still out there, you know, a degree of stigma around people who have got mental health difficulties. And sometimes, you know, getting them into, you know, paid employment, getting them into the jobs that they want to do, you know, becomes, you know, ever more difficult. And I suppose it's not something that, you know, has got easy solutions, but certainly something that, you know, for me, we should, you know, seek to explore within the Mental Health and Learning Disability and Autism Collaborative. So there are bits of work that we can do there. Certainly, the challenge of having patients who are both acutely unwell and who are also, you know, in varying stages of their rehabilitation, people who are stepping down from medium secure on the same ward, you know, limits, you know, the kind of breadth of activities that we can offer. That's not an excuse, but that's just the reality of, you know, at the limited spaces that we've got. And, you know, being able to offer a sort of kind of pathway wards, you know, where there's that strong rehabilitation focus is something that's offered in different spaces. And it's something that we can really explore in terms of, you know, a step down from the acute, low secure on site and then a rehabilitation focus. And then some of the groups, you know, as Kenley has already articulated, would be geared towards, you know, people gaining life skills, and some of them would be, you know, in the more acute phase, will be geared towards people just coming to terms with their mental disorders and, you know, getting support for their immediate crises. So trying to offer all of those groups on the same ward where people have got a different, you know, level of, you know, illness is always a challenge. But I think it's important for us to take that on board and, you know, to seek to address that. Thank you.
Thank you, Itai. Really helpful. Thank you. Scott would like to come in. Scott?
Yeah, thank you, Kirshni. Hi, Kenley. My name's Scott. I'm one of the non-exec directors at the Trust. I was going to keep it brief, Kenley, but I just wanted to take a minute to say, I think, I know you're just sort of living your life and doing your thing, Kenley, but, you know, from my perspective, you know, listening to what you've just told us, I was struck by just how incredibly impressive it is. And I wanted to tell you that because, you know, not only have you made such successful strides forwards in your own health, right, but also over and above that, you know, you've been able to sort of recognise that the aspects of the things that have made a difference to you are the activities that you're involved in that have given you additional stimulation. And you know, the sort of pinnacle of all of that is obviously your health, but just, you know, you almost casually mentioned it to us that you've achieved an external accreditation as you've been going through all of this. That's really impressive stuff, Kenley. And I just wanted to say, just as you're about to take the next step as you move forward, you know, with your own health and your own sort of future steps, I'm absolutely certain you'll be fine, because, you know, everything that you've talked about here just really, really rocks me back on my heels about everything you've been able to achieve. And I wanted to say thank you for that. It's been a real privilege to hear it from you. So thanks very much. It's an honour.
Oh, thank you very much.
Just very quickly, something that Kenley didn't mention, and I kind of want him to big himself up a little bit here, and Itai will appreciate hearing this as well. I know Kenley got some news yesterday, which you just told me about today. Do you want to share it?
Yeah, so I'll start work on next Thursday.
That's absolutely outstanding.
That's fantastic. Yeah.
Oh, that is brilliant.
Yeah.
That's
fantastic news.
really brilliant. And Kenny, I don't know if you can see, there's that now on the screen, there's some golden hands clapping. Really, that's just done kind of just to really illustrate. I mean, you know, I think Scott, you know, what Scott said was incredibly powerful. I know we would all support that. And then just to cap it all, we've heard that great news. So really thrilled for you. And as Scott said, you know, sounds like everything you rightly deserve. So thank you so much for coming and talking to us and being brave, as others have said, to share your story. I know it's never easy to come and talk to a bunch of sort of relative strangers on screen, but you know, your story is really important, and I think there are some important lessons for us, but also feels like a little bit of pride that we can take in the support that you've received and the progress that you've made, actually, most importantly, the progress you've made for yourself. So thank you so much. Thank you, Dave, as well. Was there anything else, Jean, that you wanted to add before we close off?
I just wanted to provide some assurance that it is something that we're looking at in terms of, I know the Trust used to provide the opportunity for City and Guilds qualifications for patients, particularly on Meadowbank. That stopped, I think, during COVID. So we are trying to reinstate that. And it's absolutely something that I'll pick up with Dave in terms of if there's any individuals on his unit that also might be able to proceed with that once I get the agreement from the team.
Great, thank you so much for that, and thank you, Dave, as well, for coming along and supporting Kenley, and thank you again, Kenley, and good luck. Is it Thursday? Was it Thursday we had? So good luck.
My induction's on Monday, and then I do every Thursday and Friday. I do 6 a.m. till 2:30. I'm just like making sandwiches for like M&S and that, so. Well, it's something.
Yeah, well, excellent. Good luck.
Excellent.
Hope the induction goes well, and thank you so much again for joining us. All right, take care. Thanks, Kenley.
Thank you. Bye.
Bye.
Thanks.
Brilliant. So thanks, Jean, for organising that, and Itai for your insight as well in relation to the sort of service that we provide there. And as ever, rich learning for all of us, I think, hearing patient experiences directly from somebody who's, you know, experienced our care, really. So really important. Thank you. Okay, well, let's move on then to item 8 on our agenda, which is the risk item today. Paper D is our organisational risk register paper. Chris, is there anything particularly you wanted to highlight from the paper today?
Well, we can either take it as read, Christian, or I can just pick through what I'd see as, I'd see as 3 or 4 highlights in it. Yeah.
So yeah, happy for you to, if there's anything you particularly wanted to bring to our attention briefly, then happy for you to do that, and we can then go straight to questions.
Yeah, okay then. Yeah, I think obviously the new commissioning and collaborative committee is important, which we'll talk about in the committee reviews. On the well-being, we're working still with the cost of living and things to support staff, which I know is close to everybody. And on the strike position, working closely with the trade unions, and there are obviously requirements to us filling the kind of EPRR back to national and local, and we've got a strike group involved, myself, Jean, and the HR team, and Richard. And we did a deep dive on the cyber risk of the joint committee, and on the system risk, we're working with looking at the focus on the shared understanding, which Richard, as our interim director of governance, is leading. On the risk appetite, we took that to the 14th to the board review, and then at the recent meetings there was some discussion with non-execs about the risks that are under appetite. So the execs are going to look at those and take that on board to see what's needed, and then it's really for assurance from the board and any questions to the risk owners.
Okay, are there any comments or questions that board members would like to raise? Angela.
Yes, thanks, Krishni. So the only addition that I think, just to signal to the board, is that, and I was going to mention environmental analysis, there's obviously been a lot of focus around closed cultures in mental health environments, learning disability environments, and the the receipt of the National Director letter to all trusts around quality and safety reviews. So I think it will be appropriate, and we are already very focused on that work before any of that media expose. But clearly I think it's important that we understand that risk and that we actually quantify and understand and demonstrate the mitigations that we've got in place. So I think that's a future one that we'll need to obviously support and bring forward, Krishni. I just wanted to signal that. Thank you.
Angela, thank you. I was actually just going to raise, because I think it's referenced in the patient safety report that were, or somewhere anyway in the papers. I know I'd made a note to think yes, I know. Well, obviously we'd heard from you, I think previously, that work was underway. I just wondered about time scale for when we think we might want to be reporting back to the board about that review.
I think Julie can probably talk about the timescales, but what I would say before Julie does that is that obviously, as I said just briefly now, that this is something that is always a focus for us. So it's really important. This is just not new and important to share that with the board. But James Mullins, our Director of Patient Safety across our group, is leading the work. And I think that Julie can probably describe that in more detail, and also the timescales that we can anticipate.
Thank you, Angela. Julie, do you want to come in briefly on that?
Thank you, Krishni. Thank you, Angela. I was actually going to bring this up under the patient safety report, but I'll bring it up here. So yes, we are doing a piece of work of assurance at this present time, but it is an ongoing thing, and it has to be an ongoing thing. So actually there's several streams of work we're doing. We're looking at how we provide the assurance going forward, what we're already doing, what we're going to do differently, because you always take a time, don't you, to reflect and strengthen. So we are doing that at the same time. But as Angela says, James is leading this piece of work, and it's going to our next strategic exec board in beginning of November. And then it will make its way to a next board and through our other governance routes. But the other thing we're also doing is, in the first session this week, is we're doing some sessions with staff, awareness of closed culture. What does closed culture mean? So we had a presentation to the senior leadership team this week, and we'll continue to roll that across the trust, because I think there's more than one way of looking at this. And we're looking at, as you would expect, not just quantitative data, but qualitative data, We're looking at soft intelligence as well. We're all doing service visits, and it's important that those service visits feed into this information as well, including patient feedback, patient stories. So today was a prime example of how we can use patient stories in reviewing closed culture, because I think this is important. So yes, I can assure you, Krishni, we've got this, and we will report at next board.
Thank you, Julie. That's really helpful. So we have a number of other comments and questions. Richard Wheeler, next,
yeah, thanks,
please.
Krishni. Just in relation to B8, as the paper, the financial risk, as the paper says, I'm currently reviewing that, and we'll review that as an exec team at the beginning of next month. I think sure the board's aware, due to the inflationary pressures, sort of COVID pressures, and as Dave was referencing earlier, the pandemic impact on people's mental health. We are in quite a challenging financial position. We're also just taking account of the government's autumn statement last year. So obviously pleased that there was new money announced for the NHS, and equally very importantly for social care. So will start using that as part of our planning for next year, and any improvement we can make in the current financial year.
Thank you, Richard. That's good addition to note for the meeting today. Judith?
Thanks, Krishni. I just wanted to really welcome Chris's review, or rather the group's review of the risks which are under appetite, which are actually greater in number than those who are over appetite. And as a learning organisation that we are, I really welcome the fact that we could potentially be more innovative, and we do have more risk appetite to take in these specific areas. So would very much welcome that piece of work and look forward to it. Thank you.
Thanks, Judith. Maria?
Thank you, and thanks to Angela and Julie. I'm sort of going back to the points that they reported on in terms of the closed culture piece, and we did discuss that in Quality and Performance Committee and in the Part 1 Quality and Safety Committee as well, in relation to our commissioning role as well as our provider role. The only thing I was going to add was just for us to think about briefing governors on the work that you're doing as well, because the closed culture issue and getting assurance on that is something governors have raised before all of this initiative from the national director. So I'm sure they'll be really interested to hear the work that you're doing now and how we as a board have got assurance. Thank you.
Thank you, Maria. I think we did reference the work that James was doing at the last council, if I remember, Angela. So I think you mentioned it, didn't you?
Yes, certainly. That's just what I was
and I think
say.
we also, yeah. Go on, Angela.
I was just going to say, yes, we mentioned it, Maria, absolutely, because recognise the role in governors in this as well, and they were very supportive of the work we were doing, but also wanted to hear more, and we committed to coming back as we would to share more. So that's already scheduled. Thank you.
Okay. Yes, and indeed, Richard has noted that we agreed that we would invite James to the COG to feed back to COG on this point. I just wanted to raise a brief point on G6, the workforce resourcing strategies and processes risk, and really just to mention, I mean, Chris was present, but at the Regional People Board, which took place on Tuesday, retention is a huge focus across the whole of the region. I mean, it's a challenge for everybody, and so I think one of the things that the region was planning to do was just try and bring everyone together to try and sort of agree what are the really sort of evidence-based key impact actions that we all just need to make sure we've addressed. So I think helpful that we've obviously got our own work that we're doing, and everybody has their retention or putting in place a retention lead. And there might be some additional insights coming from that retention cross-region retention webinar that's being proposed to pull some high impact actions together. So I just wanted to reference that. Thank you for the report, Chris. I think we're just invited to obviously note the updated position, but also endorse the risk appetite, because colleagues will recall at the board workshop, we did take the last board workshop, I think it was, Richard, we did take the opportunity to refresh the risk appetite, and that's noted in section 5 of the report. So the board is asked to just endorse that, really, because obviously that will then be applied and taken forward in the ORR going forward. So is everyone comfortable to do that? I think the key point was on increasing our appetite, if I remember, around grow, and I think that's the key point that we agreed. Okay, thank you very much. I'll take that as endorsement of the risk appetite, and obviously we've received that report. So we move on then. Jean, we have an opportunity to receive an oral update from you on COVID position and system-wide winter planning. Over to you.
Thank you, Krishni. It remains very challenged across the Northamptonshire system and in fact the region from an urgent care point of view, but also from a mental health perspective. Anne and her team continue to battle on a daily basis for the number of admissions far exceeding the beds available. So it is something that is continually reviewed, and we have put in additional escalation processes now to try and ensure all patients who are waiting for something to enable their discharge are in place. From an acute point of view, they have been on April 3 and April 4 consistently pretty much since the last board. Last Friday, KGH declared a critical incident because of the situation they were in from an A&E point of view. What we are seeing now is a high level of acuity for paediatrics as well as adults, and a high number of respiratory illnesses that are being admitted into both acutes. We're also seeing that in some respects into our community beds, and I'm sure Julie will update later, but we have had an outbreak in Daintree ward. I'm thankful to say that that has now opened, but it is causing a concern from the acute's point of view. There are 3 wards now in NGH that are closed today with COVID patients, but we are seeing high levels of flu as well. So pretty much it's going as we anticipated it would, Krishni, and we will obviously continue to ensure that we are offering everything that we can to keep our patients at home and not going into hospitals, and if they do go in, to get them out as quickly as we possibly can. But it does remain very precious.
Thank you, Jean. Is there anything you need from the board in terms of support? It's an easy question to ask. Thank you, Jean. Are there any questions for Jean on what she's reported? I think we all recognise how challenging it is, and as Jean rightly says, it's challenging across the region, and I'm sure across nationally, and obviously, you know, working together as we're trying to do collectively through the integrated care system approach is the key to trying to solve these problems together, which I think we will all recognise. So thank you, Jean, for that update. We move on then to our assurance report from the Joint Performance Committee and Quality and Safety Committee. And I think it's Scott who is going to provide the update today on that. Scott?
Yes, thank you, Krishni. Thank you for that. So I think what I wanted to just draw out for a moment was that almost our discussion here in the board meeting had sort of reflected some of the conversation that we were having during the joint committee. The joint committee itself now comes sort of third in our sequencing of meetings, because we have quality and safety one week followed by performance the following week, and then the joint committee in the afternoon of that performance committee. And as a consequence, what we're finding is, as you can imagine, as I've heard this morning, we've already benefited from Chris taking us through the organisational risk register and all of the interaction and dialogue around that. I think the joint committee, therefore, although we clearly still have responsibility to look at the organisational risk register, what we're finding is that the value's been driven out of that already in all of the conversation that takes place at the other committees, and that as part of the evolution of the joint committee, it now feels much more relevant for us to start to sort of focus upon it as it goes forward as an environment where we can get more heavily into deep dives, workforce activities and service reviews, and bring the sort of broader community of individuals who support both the Quality and Safety Committee and the Performance Committee together to drive for that additional insight. And I think that will be quite a valuable development as we go forward. I won't touch on anything, Krishni, about risk register specifics, because I think we've already heard that in this meeting as well. Other than to say that in this occasion, our deep dive itself was actually around some activity where we were looking at how we might consider some aspects of clinical prioritisation as we go forward. Clearly not a comfortable conversation, and I wouldn't like to leave anyone with the impression that anybody was sort of welcoming of that conversation, or for that matter, that we drew any conclusions or accepted anything around all of that. But I think actually on the day, Melanie put it best when she was suggesting that it feels like we will have challenging financial times ahead, and when you have any challenges coming down the line, it's appropriate to focus upon them so that you can plan your way through them. And I think that would probably be the tone that I would like to leave behind, and as I say, I think Melanie said that particularly well at the time. So a useful session, and something that, whilst it didn't feel like a comfortable dialogue, it felt necessary. I suppose the final thing I would suggest is that, again, in reflection of current environment, etc., what we've agreed is that at the next joint committee, our deep dive will focus around risk B7, which is around the threat of malicious activity, etc., and on critical systems. So that was all I wanted to go through, Krishni, but happy to take any questions.
Thank you, Scott. Any questions for Scott? Okay, nothing particularly, so thank you for the update. I think we'll pick up a little bit more about the next steps on the development of the joint committee in the report relating to the committee and sort of board effectiveness item. So I think that's detailed in there. So we'll just take your report, Scott, as assurance around the deep dives and conversations that you've undertaken. So thank you very much. We'll move on then to the strategy section of our agenda today. So first of all, we have the opportunity for what we call our environmental analysis, which is really just an opportunity to sort of deal with anything that's emerging that isn't covered in our papers that's happening around us, particularly from a system perspective. Angela, is there anything you wanted to highlight as part of that?
Yeah, just a couple of things, Krishni, please. So again, since we've met, St Andrews Healthcare, who people will know we are supporting via the East Midlands Alliance and through Julie's Improvement Director and ourselves as Buddy Trust, have had 2 publications on their services, their women's health and their men's health, and we're pleased and would note that there is improvement noted within those particular reports. So again, if people haven't a chance, those are obviously publicly available, but important that we are aware of those. And then also just to say, and Dave and G may want to comment, but Claire Fuller also visited the county. And for those that haven't come across Claire led the national review around primary care, and she came to talk to key colleagues this week, I think it was, in fact. So again, maybe Jean or Dave would want to comment on what was discussed there. Thank you, Krishni.
Thank you, Jean.
Yeah, it was a really good session, actually. Claire was very open and honest and candid with us not candid, open and honest in terms of what she's seen work in other areas of the country, which I think was really helpful. Giles, at the beginning of the session, presented an update with one of the priority GPs, the work that ICANN have undertaken. She was very complimentary of that. She challenged us to go a little bit further and consider other things such as mental health, etc., as part of that too, which, as people will know, that's something that Anne is already working on as part of the collaborative. So it was a really helpful session, and I think it certainly gave everybody the opportunity to think about what we're doing and how far we can really push that out of hospital care, and particularly involving colleagues, but more perhaps than we have in the past from the acutes. So I think it was really helpful. We'll just need to make sure that we come back round again, close the loop, and ensure that we're taking forward those things that she raised with us at the meeting.
That's great. Thank you, Jean. It's important, isn't it, these sorts of opportunities to sort of take a fresh look at things or challenge our perspectives. So it sounds like a really good session. Was there anything else any other executive colleagues wanted to add in relation to general environmental matters? No, I will just say, you know, I think we should recognise, you know, I know there's a lot of support and work has gone into from the East Midlands Alliance colleagues and others to St Andrews. I particularly just wanted to recognise Julie's role as Improvement Director and thank Julie for the work that she's done on behalf of the Alliance and on behalf of us as a board as well in supporting St Andrews, which I know they've really valuable, and the region has been very complimentary too, so it's been really positive to see that. Okay, thank you very much for that. We'll move on then to my report, paper F, which is the chair's report. I'll take the report as read, but I just wanted to highlight a couple of things. One was to say, actually my highlight of the last maybe the last month or two, that there were some really good Black History and Diwali celebration events, and Diwali in particular was really, really fab. There was something wonderful about that event. I think partly because it was an opportunity to understand more about it, so it was very educational. There were people there who celebrated Diwali and there were people there who didn't celebrate Diwali, but everybody was there to learn, and that was fabulous. And one of the reasons why it really struck me was I believe that one of the people who presented at that event, one of our doctors, was actually somebody who'd come from overseas to work with us. And she just said how struck she was that she was from India, and actually just the fact that we were even talking about Diwali, which is something very important to her, made her feel really included. And I thought that was incredibly powerful to hear, that kind of small step of talking about Diwali and celebrating it and marking it in the trust, how important it felt to members of staff who celebrated that. So it was a really lovely event, and I just wanted to thank colleagues for putting that on. We also had some really good Black History Month events as well, which I know people would have participated in. Just in terms of things that I'd like to particularly note in terms of councillor governors, I wanted to draw attention to the fact that Councillor Chris Smith-Haynes, who's been representing Northamptonshire Council, is stepping down from the partner governor seat and is being replaced by Councillor King Lawal. I believe, Richard, we've got the induction for Councillor Lawal next week, so we'll look forward to welcoming him to our councillor governors, and really thank Chris, because she's been I think a representative for quite a long time on the councillor governors, including as representative for Northamptonshire County Council when it was in place as an organisation. So particular thanks to Chris. And I really also wanted to highlight the progress we're making in recruiting replacement for Maria, who we're obviously very sad to be losing, but we're looking obviously actively working to find some to make some non-executive director appointments. So I believe a number of colleagues have agreed to be part of the stakeholder panel, which I really appreciate, and it's going to be, you know, important really to have as many board members involved in that process. And thank you also to governors who've volunteered to take part in the governors stakeholder panel, both of which we recognise are important contributions to the process that we undertake. We are hoping to conclude the sort of internal process, if you like, in terms of identifying a preferred candidate in December. And in fact, of course, it's 2 candidates, actually, one voting non-executive director and one associate role. And the plan will be to propose the preferred candidates to council in January for approval. So that's where we are with that. But thank you for agreeing to participate and support that process for both governors and board members. So unless there are any questions relating to anything in my report, which I don't see that there are, so I shall just hand over to Angela then for her Chief Executive's report. Angela.
Thank you, Krishni, and I just want to draw attention to a few items, but also some additions that are important since the report was written. So start importantly with thank you to staff as ever. We've heard already this morning around the challenges in operational services, but I think it's important to say whether you're in clinical operational services or corporate services, the challenges are the same. They are demanding and people are really rising to that challenge. So enormous thanks from all of us to every member of staff. And I bumped into a member of staff this morning who works in the Welland Centre, who came over to do some training. And I was just talking about the challenges with him and the pressures and asking what and how did they cope with those. And he talked very much about the team support. And I think that's ever important to us to keep focused on how teams are supporting each other during this period of time. So real thank you to every team that's doing that. So just some things to highlight. Richard's already mentioned the money. Again, we'll be working through that as a system in terms of what does that mean in planning terms as we embark upon the planning regime that we anticipate to do together. Obviously, it's encouraging that there is money and the money that's described for the NHS, but I think it's also important to recognise that will still be challenging. So we've got to work through the detail, but I am really encouraged that the discharge monies, the social care monies, I think Jean referenced, have referenced mental health. I think that's really important, and we must use that in the county to, if you like, get parity around the discharge that we need for people in mental health beds as well. So you will see from the report that there are a number of awards and recognitions which are really important, not least because they motivate and validate what people are doing, but also acts as a way for others to understand what we're about as a trust. And, you know, recruitment, all of those things, these are all elements that contribute really. But I was really pleased to see the quality accreditation for the boroughs, you know, to join the set, you know, being, you know, the only CAMHS units in the region. I think, you know, we say it quickly, but a lot of work goes into that. And as the lead provider for CAMHS in the region, I think it's really great that we are in that position. And again, that's a testament to all the staff working in those units. It really is fantastic to be in that position because we know these are really challenging times for people working in CAMHS units. But I was really pleased that our chefs in Isbrook also got recognition, and obviously Kenley also mentioned food today. So really pleased because, you know, that is important, and disappointed they didn't become the winners. But the fact they were shortlisted is fantastic. So enormous thanks to all of them, and I know we got some local press as well for that, which was great to see as well. Really pleased to be one in the top 10% nationally for the Workforce Disability Equality Standard as well. That's not to say there's not more to do, there is more to do, but of course our staff networks are really advocating for that, giving us the staff voice, and the fact that that is progressing is really important for all of us and something to build on further, as you'd expect, but recognition nevertheless. And then obviously a lot of awards around mental health, which again we continue to build upon, but I don't want to just gloss over them. And for sexual health, I hope people have had a chance to have a look at those. They really are a recognition of work people are putting in. So if you get a chance to say well done to people, I know they would appreciate it because these are not easy achievements. And then last week we also went to the HSJ Awards. We were shortlisted for Trust of the Year. We didn't win, but it was fantastic to be there. Again, as Team NHFT, and I was pleased Simba was one of the team that came with us. We had a good night, Simba, didn't we? And I think again, it was really good to be out there and profiling what we're doing as an organisation, but really important to say that Northamptonshire Care is one. So it was great to celebrate with them on the night as well. A real fantastic achievement. And then just a couple more things to mention. We've also, over the recent weeks, just also done celebration on International Men's Day. We did this jointly with our group partner, Leicestershire Partnerships Trust. Again, good events, and we continue to build on these events, and I know a lot of work goes into them, so thank you to those people that have been putting that forward. And of course, as a board, we also spent time with Leicestershire Partnership Trust on our joint strategic priority around Together Against Racism this week, which was a really important board development session, but is also profiling our commitment to becoming an anti-racist trust, which of course is something that we've spoken about previously. And then the final thing I would mention is that Anne and I and Itai were also involved in the Mental Health, Learning Disabilities and Autism workshop this week, which was part of the collaborative work that clearly we are leading. But I think we had a really good, again, multi-agency, face-to-face workshop. We're able to have service users, carers to remind us about why we have the collaborative and what we're trying to achieve. We had chance to consider what place is starting to mean in the county and how we need to interface with that as a collaborative. We talked about risk, and Richard Smith was able to, with Morgan Price, able to give us a sense of how we manage risk as a collaborative. And I think, again, we had some national colleague come and talk about accountability. So it was a really good workshop. And the reason I mention it is not least that it was a good workshop, but because it is part of the maturity that we're developing in the county, and clearly that is also paving the way to influence the other collaboratives in the patch as well. But I'll leave it there. Thanks, Krishni.
Thank you, Angela. And there were a lot of really positive recognition there. So much so, actually, I missed whether you mentioned the Midas Awards on Friday. I know. Actually, because I know we mentioned them, the board was aware because we shared with the board, I think, at the Together Against Racism event, but it's probably important to mention those as well, that the Trust was recognised for its excellence in executive leadership around the inclusion and diversity agenda, particularly in relation to race equality and the work that was doing. I think Angela rightly said to us on Monday that that doesn't mean we've achieved what we set out to do, but we need to recognise the positive steps we are taking. Our staff network, I think, was highly commended as well.
Highly commended,
so
yes.
Amelia and Mo.
Yes, absolutely, highly commended. And also, I think, and it's just prompted me, Krishni, is that there's another set of awards, the APNA Awards, where our staff network are also shortlisted, as well as ourselves with Leicestershire Partnership Trust in terms of some of that work. So again, it's increasing the sense of others knowing about what we're doing. As we said Monday, it doesn't mean there's not more to do, there is. But I think it's really important that people recognise our commitment, and that in itself gives us the energy to keep going in terms of delivering it. So it's always good to get that validation. I know the staff network members were really chuffed and pleased to be recognised in the way they were.
Brilliant. And all these things, I think, the presenters on the Together Against Racism session highlighted actually the importance of celebrating these moments, because these are hard things to change and move forward. And we all recognise that moving our res data has taken us years actually of consistent and work to really try and to do that. So these are, because culture change takes time, but so celebrating small marginal gains we talked about, but they can feel really, really important to make those improvements. So really positive and really really good to see the recognition that colleagues have achieved as a result of the work that's been done. So is there anything that we would like to clarify in Angela's report before we move on? No, okay, thank you. And I did particularly also want to draw attention to Northamptonshire Carers, because of course Mark Majors, the Chief Executive of Northampton Carers, is one of our partner governors, and you know, makes a huge difference, I know, in our system, and certainly on our council as well. So I was really delighted to see that the organisation had been recognised at the HSJ. So we'll note all of that positive update from Angela, as well as the challenges that she's clearly highlighted in the report. And we'll move on to paper H, which is the review of strategic objectives. Now, I think in David's absence, I don't believe David has joined us yet. Is Alison going to just cover off this report, Alison?
Yes, I can do that, Krishni. Thank you. Okay, just the board to note the content and the progress of the delivery that we've made on our strategy DBQ, which is obviously taking us on that journey from where we are now to the delivery of our overarching vision of being an outstanding provider of compassionate care. The paper provides the quarterly update that the board has previously requested on the key deliverables within our strategy, so develop, innovate, grow, build and quality. And it's progress and sort of highlighting the progress and the success that we're making in the delivery of all of those key objectives. I'm not going to go through it in detail because I'm assuming it has been read, but just to provide assurance that overall the progress is on plan. And we've also linked and noted the critical relationship between our corporate risk register and the risks noted there with each of the deliverables, and you'll see those highlighted in each section, so you can see where that those deliverables are mitigating against the risks. Just also to provide you the assurance that through our internal governance processes, so for example, Transformation Committee, Strategic Exec, for example, and the first Commissioning Collaborative Committee tomorrow, that we are assured that progress is, as it is stated on the report, and confident that we're delivering against each of the strategy objectives and plans. Happy to take any questions. I'm conscious that I've got colleagues in the room who've got more detail around each of those specific deliverables, and I'm sure they'll come in to pick those up where they can. Thank you.
Thank you very much, Alison. Really helpful. Are there any comments or questions that people would like to raise? Angela?
Yeah, I mean, I just want to say I think it is a really helpful format. I really like it because you can see quite quickly what is happening, what the progress is, and who's responsible and accountable. So I think that's really, really helpful. Thank you. But I would just draw attention to, we've got in the quality and safety, it says Julie Shepherd, Group Chief Nurse. Julie's not the Group Chief Nurse. So important just to rectify that, please. Thanks, Alison.
Thank you, Angela. Will do.
Thank you, Angela. Judith?
Thanks, Krishni. Totally echo what Angela has said about the report, Alison. Thank you very much. It was really detailed and it was really good to understand the deliverables for the next period. My question really relates to the two aspects of our strategy, which is the grow and the quality, where the risks related to that in our risk register are outside of risk appetite. I was wondering if in relation to those two specific aspects of the strategy, there are plans to present a more forward-looking plan on deliverables. Are we going to be able to meet our long-term or even annual deliverable targets for our strategy, bearing in mind that those risks exist outside risk appetite and are frankly not within our control?
Thank you, Judith. And I don't know whether Julie or colleagues want to come in to just to sort of help respond. I think absolutely yes, there's an appetite to, and we should definitely be looking at a forward-looking view of what the plan does to provide us with the assurance that we can mitigate against the risks where they are currently outside the risk appetite. I'm hoping that there's going to be a joint conversation around this at the joint working group in January of next year. So, but I don't know if colleagues want to add any more detail, any more comments and thoughts.
Angela? Oh, yeah, sorry. Chris, yeah,
Chris.
Angela first and then Chris. All the other way
just
around.
To say, I think it's important to say that, yes, we need to continually, Judith's right, we have to continually review what's happening, and not least with our system context changes, and our regional context changes, it is ever important that we're doing that. So I think we just need to determine the way in which we do that. Obviously, this quarterly update is helpful and provides a mechanism, but if there's anything further needed through subcommittees, we can do that too.
Okay, Chris, do you want to add to that?
Yes, I think obviously we shared the people plan with the board, which sets out that a lot of ambitions there. And I think on the risk appetite, moving up a level and looking at the levels of innovation, we are considering those. I think it's in Julie's report, there's the mention of looking at a really seriously ambitious approach to apprenticeships and how we might do things, and whether we could use funding to do that, which would be really stepping outside. We've also talked to the executive about a major recruitment campaign for our healthcare support workers, bringing large numbers in, and we face a real barrier that historically we've needed people with care experience. Can we find a way to bring people in who haven't got that, but we can take them through their care certificate, and some other trusts have done that. So I hope just those two examples give an assurance that we are continually focused on the innovation to allow us to push on this, as we've described and fed back to the board, wicked problem, which we also fed detailed information back to the performance committee.
Thank you, Chris. Melanie?
Hi, yes, thank you. I just had a point of clarification really around the areas in where we have green and we have some which are not coloured at all, even though they are for activity this year. And I wondered why, what the decision process was in not colouring some of the leads boxes. Does that mean that we're behind? Does that mean that we haven't started yet? Is that just a different subjective approach by the lead themselves as to how they want to rag it? And I note particularly, therefore, that in the quality and safety section, there is a lot of rows which are not coloured at all, and therefore wanted to understand what that meant about our progress in these areas, please.
Yeah. No, thank you, Melanie. It's a good question. Yes, and it's something that we've recognised that we need to look at. And please don't assume that where it is white, there is no assurance. I think we're confident through the internal conversations we've been having through our subcommittees that assurance has been given. We'll just make sure that that's updated and corrected for the next quarterly update.
Thank you.
Thank you, Alison. Yes, just to be absolutely clear, I think we just need to be consistent in the way we present it if that is the issue, so that it's really clear where the assurance is being provided. Julia.
Thanks, Christy. It's just an observation, really. Really good report. I really welcome being able to see very transparently all the work that's going on. And I suppose the observation is that although some of the risks are really high in some of our areas, we know about them, and it's absolutely essential we carry on with this almost despite the risk, because if we don't do it, I'm thinking particularly around capability, etc. If we don't do the actions that we want to do and that we've outlined here, then actually the impact is quite drastic, and we won't have the workforce in the future, and the risk will just be completely off the scale. So it's just sort of framing it for me in they are very stretching ambitions in the climate we're operating in, and actually to be able to achieve these, which looks as though we are and we're on track, is really a credit to everybody, huge credit. Just wanted to sort of highlight the environment we're in, so thank you.
Thank you, Julia. Judith?
Thanks, Krishni. Just a very small comment in relation to the grow our staff capability. There are Fiona still appears as the lead, and clearly that will need to change to Richard. But also in relation to this G10 strategic objectives, there are no actions that are captured for reporting for the next period, which I'm sure is something that Richard will put right in for the next report. Thank you.
Richard is nodding, so I think you can be assured of that. The one thing, because I think as we're talking about the grow area, one thing, Chris, that has come up in sort of, I think it was mentioned at the NHS Providers Conference where I went to I think Julie and I actually went to the people, you know, how do we get more people session that took place at NHS providers. There were sort of various discussions about different things people are trying, and you know, a welcome, you know, you've mentioned apprenticeships and you know, really thinking differently about some of the things we already do. One of the references around reservists, and I know there was a national kind of approach or a regional approach around that. I just wondered whether, I mean, it may not be appropriate for us, but is it something that we've looked at? Chris?
Yeah, we are doing that across the system. I think that the challenge with reservists is it's asking, it's like a lower level bank, so it's asking people to commit to much shorter periods of time that they can be called on, and we are doing it. But the question is, I think, the level of resource you can put into it when we know we've got such huge problems. We need to make sure that our bank's growing so we can focus on that. So yeah, we are doing it and we have got some interest. It's just a question of which focus you put in terms of your opportunities to access flexible and temporary resource.
Yeah, and that's a really important point, Chris, isn't it? I mean, our actions, whatever actions we prioritise, need to be, you know, proportionate to what's likely to have the most impact. Yeah, thank you for that. I was just wanted to note, really, more than anything, I really welcomed seeing, you know, the establishment of an equalities enablers group, I think it was called, which sounded like a really positive development under the Innovate section of the report. And this was all about health inequality. So I think, you know, really good to see that being part and parcel of what we're developing, because it needs to be so much part of our focus going forward, because it's very easy otherwise to focus on activity and perhaps, you know, have less focus on the outcomes, particularly around inequality. So just wanted to welcome that. So thank you. I think broadly, Alison, thank you for presenting the report. I think there's a sort of you know, positive feeling about the content of the report. A few little yeah, sort of perhaps tidying up just to make it a consistent approach, but otherwise good to see the achievements and looking ahead to the next quarter, and I think a couple of things that individual owners been asked to just look at. So thank you very much. So we'll move on then to the people section of our agenda today, which starts with an assurance update of the employees trust employee relations cases, which is paper I. So Chris?
Yeah, this is a regular report that NHSI required that trust boards consider. It details the initiatives that we've put in place to improve our disciplinary and grievance processes and improve the experience of staff. We provide a regular update to non-executive directors on all the issues that we're focused on. In terms of the initiatives, we've listed out all the cases in there. In terms of the initiatives, particularly around case management, we recently had the Leadership Matters authentic inclusivity and the network's role there, and in terms of getting any concerns from staff, and we've, as a result of that, made sure we've got a dedicated HR business partner who can support that work, because they were receiving information. There's a question of how can we deal with it, so we've put a dedicated person to work with them, which has been welcomed. We've reviewed the grievance policy, and we focus much more on resolution. So when issues arise, rather than going into formal processes, which invariably don't have great outcomes, thinking about how we can focus on resolution, and in line with our wellbeing wheel that's helped with wellbeing and sickness, we've got a resolution wheel people talk through. We've had a collective grievance recently that's also informed work on the communications and details of the processes. A big challenge is the length of time that cases can take, and HR are working really hard to ensure we can manage that more effectively, particularly potentially using external investigators. Another initiative has been that in terms of that informal element, we've now got a specific senior panel that reviews the cases that come through, and particularly in terms of whether they should go to formal or informal, because as we know, we have had historically the NHS had challenges, particularly around ethnic minority staff going into formal processes, and that's really helping. So it's always giving scrutiny basically to the processes they move through. We've also undertaken an independent review of a particularly complex case we had. Again, so it's sharing with the board, giving assurance that where we've got big cases, we're using that as a lessons learned approach. We've produced some flowcharts, again, giving more and more clarity each time about what's happening. And with the medical staff, we went through a very deep dive review of the MHPS cases, that's the medical cases, to understand what we can improve and do with that. So I'd recommend the report as an assurance to the board that we are putting the people first in the processes and continuing to improve our employee relation processes across the board.
Thank you, Chris. And it is it's important assurance, and reminds me actually that one of the conversations we had at the Together Against Racism event was recognising, that concern that we still had around the disproportionate impact of or disproportionate level of disciplinary cases that are, albeit small numbers, but that are ethnic minority staff might experience. So it was good to see in the paper the sort of additional action that's already in hand around reviewing, how we support, how we sort of minimise these cases being escalated to formal in the first place, which I think is one of the issues we've identified with that particular bit of res data, isn't it? So that's really good. Yeah. Any other comments or questions? Judith?
Thanks, Brittany. Very, very briefly, as the non-exec who has oversight of these data, I just really wanted to thank Chris for that report, and to wearing a different hat. I do have a role within the Courts and Tribunals Service, and the delays that are occasioned by involving any court or tribunal, I'm afraid, are only going to get worse. And I just wanted to highlight that for the board. Thank you.
Which of course means that if anything is, actually has to go to court before, I don't know exactly whether that's always the case, but sometimes, cases do have external elements associated with them that are not within our control, and that can obviously prolong things. So thank you for sharing that. And it is important to note Judith's role as a non-exec. That is one of the things. I think this sort of the recommendation was that we have a non-exec in place who just reviews the data regularly, so actually not the individual cases in detail, but that understanding of cases that are taking quite a long time, because I think that's been the real concern that underpinning this original recommendation. Melanie?
Yeah, I'd just like to maybe emphasise as well what I suspect is a key responsibility of the Trust in these cases that are delayed. I mean, I personally am involved in a disciplinary that's now been pushed out to 2024, having actually happened in 2021, which is a ridiculous timeline. So I think there is an ongoing responsibility, I think, for the Trust to consider the well-being of the people who are suffering or having the impact of these delays caused by external factors. And I think we should just emphasise whether that's, I'm not sure that we are clear as to whether that's, if it's appealed, if it's going for the first time, the levels of accountability maybe for wellbeing that we might have, and the kind of services that we can still continue to offer. So not now, but maybe in one of the workforce discussions that we have, and the next time we visit this, Chris, it might be useful just to understand, the sort of the range of wellbeing services that we can offer people who are impacted by these delays.
Yeah, thank you, Melanie. I mean, I think the wellbeing point was the key point that this recommendation really emerged from, because sadly the case that actually prompted the review was a member of staff committing suicide. So I think we should remember that. But Chris?
yeah, just to assure the board, we do have a real focus on the wellbeing and the support that we give to people as we go through the processes. I think it's important to note that some of these are so complicated and you know, they are very difficult to manage through. So it's important that we continue to push to resolve things and also make sure we have the support for the individuals involved.
Yeah, thank you, Chris. So I think, yeah, very, we need to make sure it's people-centred. I think we're all recognising that. And just to be clear, that case obviously was not an NHFT case, but an external case, but at another organisation. But the review that arose from that is what this paper really builds on in terms of recommendations. Just one other small point, really good to see the resolution approach, because I remember actually pre-pandemic we had a conference where we talked about the resolution approach, and then the pandemic hit us, and I think it was difficult for us to take forward some of the sort of things that everybody discussed at that leadership conference. A small point really, and one for Richard, perhaps Richard Smith could just consider, Richard, is whether we could feed in whatever learning we've got from implementing the resolution approach to the code of conduct work that we're doing in relation to the Council of Governors, because our colleagues will be aware that, and I think I referenced it in my chair's report, that we are undertaking a review co-produced with governors around how we refresh the Governors Code of Conduct and how we processes that support that. And obviously, if we're doing something around resolution, which is fully intended to minimise formal action, if you like, we probably do want to try and just reflect that if we can, if it's appropriate, and at least share that with governors so that we can consider that as part of the process. So I'll leave that with you, Richard, but thank you, Chris. So if there are no further comments on that, I think we are just, I mean, clearly there are outstanding issues with the time that these cases can take, which Melanie has highlighted, but important to note the actions that are in place and ongoing to try and address how we support our staff through these processes. So thank you. Right, finally we have paper J on the people section. Beth was our Freedom to Speak Up Guardian was unable to join us today. So Dave, I think you're going to just take the lead on this. Perhaps just some key highlights, Dave.
Yeah, for sure. Thanks, Christine. So if I can just draw people's attention, apologies from Beth. She's had a bereavement and is not able to make it today, as Christine said. So we send her our condolences, I'm sure. On the mandatory training, I just want to highlight that as kind of a really promising figure for October, with almost 100% of colleagues completing that. And I think that's reflected in the data that I'll quickly run through. We've seen more concerns raised in Q2 than previous years. And again, I take that as a proxy indicator of us actually doing quite well in promoting freedom to speak up and encouraging people to come forward. And I can triangulate that with some of the data at the end where people are speaking up and doing it openly. We've only had a small number of anonymous freedom to speak ups. And again, I take some reassurance from that people are confident in our processes when they do speak up and they feel encouraged to do so. And we've just gone through October, which of course was our Freedom to Speak Up thematic month. In terms of key themes, we've, under guidance from the National Guardian Office, we're now grouping the incidents into the themes of patient quality and safety, bullying, harassment, worker safety or well-being, the well-being being a new addition, which I think we would welcome, and element of other inappropriate attitudes or behaviours, along with disadvantageous and or demeaning treatment because of speaking up. We've got some data then following that, highlighting where colleagues have spoken up against those themes. There's quite a significant number of those speaking ups are in the elements of other inappropriate attitudes or behaviours, which we're addressing through our leadership programme and the Talent Matters programme, which we've had some compassion sessions during October and November. There was also an issue, and I'll finish after these 2 points. We've had some feedback from colleagues about civility being something that we need to look at across some of our management grades, and we're putting some thought into that again through our leadership programme, promoting that through those networks. And I think it's a reflection, partially certainly looking at some of the feedback from other organisations, partially of where people are in their own work pressures and so on, and we need to address that through some of our well-being work. So it's not just about giving people training around civility, it's also looking at the things that are making people feel fractious and hoping to keep them together as a team. And the final point I just want to highlight relate to the routes that people have raised concerns between April and September. We've had 28 open concerns, 56 confidential and 3 anonymous concerns. And again, I think that's really quite reassuring for me, looking at that people feel, again, confident to go to our Freedom to Speak Up Guardian, confident to go directly to Angela as the exec lead, confident to know that we as an organisation have the processes in place to manage that appropriately. And I think that, as I say, is reflected in the low numbers of anonymous concerns raised. Just on your point from earlier, Christian, I mean, I guess from my perspective, I think it's quite helpful to have a touch point here mid-year just on some of this data, and kind of then do a wash up at the end of the year. So, you know, use as part of our kind of reassurance to colleagues that we're kind of taking it really seriously. I think those 2 touch points, I think, are probably part of some of the data that we're seeing here, which is positive, I think. So I'll finish there, and Melanie, of course, our non-exec lead, and Angela, feel free to make any further comments.
Thank you, Dave. I think just, yeah, I thought it was a really good report, actually, really helpful assurance. And actually great to see the sort of training level, I thought, and actually the experience of someone who'd gone through, very clearly articulated, someone who'd actually gone through the process of raising a concern and the response that we've taken. Yeah, just be interested to hear what others thought as well. I think I just wanted to emphasise, obviously, you know, freedom to speak up is really important. So my suggestion is not in any way to undermine the focus we should give. I'm very conscious that Melanie, myself, and Angela meet quarterly to review this. There is quality, you know, there is a report to quality and safety committee on freedom to speak up, and actually part of me was thinking actually having Beth annually coming to us to sort of almost do an annual report and presentation felt like quite an important step. We might want a touch point in between, but having Beth actually personally coming along annually to the board for that kind of full report just felt like we would also give it a bit more time on our agenda if there was an annual report rather than a sort of just the touch point, I guess, or 2 touch points through the course of the year. So just a thought, but I'll happily leave the exec discussion on that to conclude. Let's Melanie first, and then Angela.
Thank you, Krishni. Yeah, I just wanted to highlight maybe, in addition to Dave's update, I took a lot of assurance. I know that a lot of work goes on to triangulate the concerns raised in freedom to speak up against all the other sources of staff feedback and indeed patient PALS feedback, I want great care, etc. So, and I think it was, I took some assurance from the way that Beth in her paper demonstrates, if you like, some of the common themes that we're really focused on in our risk register as well. You know, cost of living impact, staff resources, etc. So I think that it just demonstrates how powerful freedom to speak up is to give us that additional assurance that we're focused on the right areas of risk. And I also just specifically took a lot of assurance as well from the statistics around the level of staff members raising the concerns. It's not just the managers. Indeed, you might expect the managers maybe not as swift to use Freedom to Speak Up. But, you know, we have senior leaders, managers right across the workforce using this channel to voice their concerns. And I think that, again, demonstrates the power of this kind of access to report concerns and issues. So that was all I wanted to add. Thank you, Krishni.
Thank you, Melanie. Yeah, really, really powerful, really powerful data, I think. Angela?
Yeah, thanks, Krishni. So I think just a couple of points. As Dave said, people do come to me directly. It's really important that they, you know, use all the channels that Dave described, but I just would want to say that they do that, and that's always been the case, but that hasn't changed and continues to be you know, utilised and valued and triangulated. Important to say. We also had the National Guardian's Office come to do a session, which we joined across with LPT, and that was really helpful in sort of validating what we are doing, and that connection with the National Guardian's Office is also important to us. And I think then the other thing I would say is the touch points through the board are really important, and I think we probably need to think more about a future board development session around staff voice, and to understand this is one angle, but I think there's something about staff voice. We've heard patient voice this morning. Let's think about what we're doing in that regard, but also what more we could do, and how the board has that sort of deeper opportunity, Krishni, to understand some of that would be my thoughts.
Thank you, Angela. Julia?
Thanks, Krishni. Just to build on that, so just for those that don't know, the Quality and Safety Committee take the opportunity twice a year to undertake a deep dive. So we do receive quarterly reports, but I know in our December meeting we've scheduled a deep dive around freedom to speak up, which gives us far longer and deeper opportunity to really get underneath some of the themes and some of the stories, which is really good. So another layer of assurance, and again another way of building on the reports that we actually get. Thanks.
Thank you, Julia. Dave?
Just final word for me, Christian. The personal story in here is really powerful in terms of a reflection of where we've taken action. And just as part of that story of triangulation, we do frequently run listening events with groups of staff related to Angela's point about bringing people together. So I think that's a really good idea to do something like that with the board, because it does form part of our engagement with staff where they have issues that they want to raise. We do use listening events, so that's a good opportunity, I think.
Thank you, Dave. So, Angela, can we leave it you and Dave to look at that, you know, the kind of follow up around that staff voice and any suggestions you might have around how we weave that into our programme, whether that's through board development or whether that's a reflection of how we receive assurance through our board and committee structure. But I think, you know, just to say, I thought it was a really good report, and I think it was really helpful to get a really clear sense of the different elements that the report was looking at. As I think Melanie said, you know, the levels of people who were raising concerns, the actual types of concerns, etc. So really good, really comprehensive report, and I think we can take some positive assurance from the processes we have in place. But clearly we need to continue to address the concerns as they arise and make sure that we could encourage people to use the variety of ways in which they can raise concerns about any issue really that might be a worry for people, particularly in the current climate. So thank you, everybody, and thank you, Dave, for covering that on Beth's behalf. So I think that brings us to the end of our people section, and in fact we I think it's probably a good time to take a short break. So we'll start kind of get on with the rest of our meeting now. So a little bit behind, but not too much, so I'm sure we'll manage to catch up. So we're moving on then to our quality section of our agenda, and we start with the assurance report from our Quality Safety Committee. So it's over to Julia. Thank you, Julia.
Thank you, Krishni. So I'll take the report as read. Just to highlight a couple of things to you. You'll see a number of AMBER related areas similar to the last report we received. And that really reflects the various demand and capacity issues that I think we've been hearing about through the board this morning. And just to give some assurance that the impact of those issues are on patients and staff, a real key focus for the Quality and Safety Committee. So I just thought I'd highlight that. There were also a number of reports where challenges with data accuracy were highlighted. And so we weren't fully assured on some of the underpinning metrics, but there's a huge amount of work ongoing behind the scenes to improve that. And we will keep an eye on that going forward. It's on our radar. And then lastly, around the organisational risk register, certainly as we've talked about this morning, we had a really good conversation around some of the risks, and particularly about the challenges and risks associated with embedding new NHS structures at system level. And we heard assurance from those in the meeting that as those are maturing in Northamptonshire, actually our leaders in NHFT are connected and are maintaining their ability to raise risks within the system at the different levels. So that was really important, and we'll keep an eye on that for quality and safety risks going forward. And then lastly, as we've also talked about this morning, we will be having a focus going forward on those risks that are under our risk appetite that relate to quality and safety. So it sort of echoes everything we've talked about, I think, already this morning. And that's our highlight for the board. Thank you.
Thank you, Julia. Really helpful. Any questions for Julia? I think it's a pretty comprehensive report. So everyone happy to receive that report on behalf of the Quality and Safety Committee? I think we are, so thank you very much, Julia. So we move on then to paper L, which is the Patient Safety and Learning Assurance Report, and it's over to Julie for this report.
Thank you, Chair. I'm taking this report as read. The only thing I was going to bring up was a good piece of work that's going on. Obviously, this report talks about pressure ulcers, and it's still one of our top 5 risks. And we're going to be doing a joint piece of work with LPT, our group partner, on pressure ulcers as part of the QI work. So I thought that was really good to bring to the table. I was going to bring it through this report, the work that we're doing on assurance around closed cultures, but we've already raised that in a previous item this morning. So that was all I was going to raise.
Thank you very much, Julie. So any questions for Julie on this report? So I think it was just a comment from me, Julie. I mean, you've mentioned pressure ulcers. It's difficult not to notice that the sort of trend line seems to be upwards on all pressure ulcer related graphs. So I think it's good that there is a piece of work being undertaken around that, because yeah, it just seems to be on every level, that seems to be going up. So just good to note that. Thank you. Angela?
Yeah, just a couple of comments. Obviously, as the CAMS collaborative, Julie, obviously we've got a role in terms of that quality and safety focus. Are we taking the opportunity to look at that collectively in terms of incidents and trends, etc., or learning? Be useful to understand a little bit more on that. But also just to share with the board that there is going to be a national programme on quality within inpatient settings, which is going to be a 3-year programme. It's going to be led by Liz Durant from the national team. I've already had contact for early engagement on this, so I think that's another opportunity that we can bring into our learning, but we welcome that sort of focus from a national perspective on inpatient settings generally. Thank you.
Julie, anything you want to add to on the CAMS point?
Through the CAMS collaborative, we obviously do look at SIs. It is reported through the governance structures. We also have been looking at amount of restraints to feed, and I know there's some national work just about to be published on restraint to feed. and potentially we could get the person who's actually leading that work to come and talk to the Campus Collaborative. I've been talking to other networks, so they would be, I'm sure, willing to come and talk to the collaborative about restraint to feed.
Okay, good. Thank you, Julie. If there is no further comments or questions, then I think we're really just obviously there's a lot of work going on patient safety. We've obviously got the Patient Safety Committee, which I think Julia actually attends as well. You know, it's obviously an ongoing focus, as we've already touched upon with James as well in his group role in patient safety. So thank you very much for that report, Julie. We move on then to the complaints pals. It's a very long title, this one. It covers everything, hence it's got a long title, but it's the complaints pals feedback report, really. So Julie, over to you.
Thank you. This is obviously Q2's report, as we report quarterly to the committee. Just to raise that we did have a workshop around the Complaints Review Committee to actually look at how the committee operates in the terms of reference, and I think it was a very successful workshop, and we're taking the actions from there forward. One of the things you will see is we're going to have our PALS booth touring the trust again. Obviously, we used to do this in the past and we've not done it during COVID, but that's a great opportunity for patients and families to raise concerns directly with our PALS service. So watch this space. We hope to be out and about shortly on that. I think that was all I wanted to really raise here.
Thank you, Julie. Are there any questions or comments on the report that people wanted to raise? Julia?
Thanks, Krishni. It's just a question around I Want Great Care. I know when I first started in the trust a year ago, that right in the middle of the pandemic, there were lots of issues with getting returns around I Want Great Care. And I know we've been quite consistent in the numbers for the last few quarters that we've actually received. But a little bit later on in the meeting, when we look at one of the later papers around workforce safeguards, there's several areas that have put in nil returns. So I just wondered about our approach and whether we're able now to refocus on getting more returns. Is there an ambition to raise our return rate, or just where we're at, really?
I mean, Hugh continues to work with services to try and raise returns from service users. So it is something we continue to work on, Julia.
Thank you, Julie. I mean, I have a linked point on I Want Great Care, actually, that I wanted to make. So did Melanie, I see Melanie and maybe you didn't want to come in, but were they on I Want Great Care, or was it on something else? Because maybe as I've got something else on I Want Great Care, I'll just mention that whilst I have the opportunity. So I suppose, you know, I've always found I Want Great Care really powerful and very easy way of sort of seeing, you know, that very immediate way of getting feedback from our patients and service users. So obviously Julia makes an important point about encouraging that, and the pandemic, the challenges of the pandemic, we obviously recognise. I think I just wanted to reflect that I wondered also whether it had affected our responsiveness around, so when I Want Great Care, but you know, people do make comments, how well are we actually on top of, you know, what assurance do we have that we're actually being as responsive as we should be? Because of course, when we get that gift of feedback, we have to be able to kind of respond to that. And I think that is the process. So how assured we are on that. And an observation about the word cloud. I felt for the first time that I saw words in there that I haven't seen before. I don't know if anybody, you know, the word cloud is really powerful usually with I Want Great Care. And there are words in there like removed, which I don't have a real sense of why that might be, because I don't ever remember that word being there before in that word cloud. So there are some interesting things I think about that, and I just wonder whether, obviously not for today's meeting, but I wonder whether the Complaint Review Committee could just have, get some assurance around the question that Julia raised, and about responsiveness. And then, is there something changing in the tone or nature of the feedback that we're getting? So I think it would be helpful to understand that, but to appreciate that, it's not probably something, Julie, you would have to hand. So it'd be interesting if that's on the agenda for the Complaint Review Committee to consider. Would that be okay? Thank you. Melanie.
Thanks. Yeah, I just had a query or seeking assurance really from attendees of the Complaints Review Committee, which I no longer attend, on the overdue actions, because I understand the vast array of competing priorities for our daily work. But the 57 overdue actions, I note that the oldest one is from November 2021, which seems an excessively long period of time for an action that's arisen as a direct result of a complaint to be resolved. And I wondered whether the Complaints Review Committee were looking at this area of overdue actions, the age of some of the actions, and given that they are apparently discussed at weekly senior management team meetings, I wonder whether there was assurance in the Complaints Review Committee that these would all be knocked on the head pretty quickly.
Any comment on that that anyone feels able to give?
At this stage, I'm not able to. Jean's just about to come in, but at this stage, I can't give an update. But I can certainly give an update to the next committee. Jean.
Hi, Melanie. I think it's a really good point. I know that Anne and Rachel do go through it on a weekly basis, and we discuss it monthly in our ODF. So I just need to go back and check that because it doesn't seem right to me based on the discussions we've been having in the operational team. So I will do that, and I will come back to you, Melanie, so you're aware.
Thank you.
Thank you, Melanie, and thank you, Jean, for that. So I think some sort of questions really, and areas for the for follow up from the report, but really helpful report. And I think, as always, I do find it very useful that we look at the contacts versus complaints position, because clearly there are the percentage. Context for us to note, but really useful report and just some follow-up areas I think to go forward with. If there's nothing else, I think we can close that item and move on to monitoring workforce safeguards, final paper in this section. So back to you, Julie.
Thank you, Chair. I'll take this report as read. This is the 6 monthly review where we use obviously clinical judgment and accredited tools to look at our inpatient areas establishments. So that exercise has been undertaken and the results are in this report. You will also see from the report that there's a community nursing tool that's now being developed. Our staff are in the process of being trained in this. This is a new tool. It's been long awaited for, so it should help us with some of our dependencies in understanding them in community nursing. And the report asks us to support the recommendations in Appendix 1, which are mainly about doing a review again of establishments apart from one service, which is a proposed induction of an activity coordinator on Spinney, and this would be achieved with a skill mix. So it's just support, just for noting really. These are the outputs of the 6 monthly review.
Thank you, Julie. Any comments or questions regarding the report? Yeah, I'm sure we're happy. Oh, Jean?
I just wanted to provide the board some assurance, Christian, in relation to the red beds. I think the paper is slightly out of date because the recruitment has gone really well and we've actually appointed to all posts from an NHFT point of view. They're just not in place yet. Thank you.
Thank you, Jean. I think, I have just one query, and it is something I know we've touched on before, and obviously there's some commercial elements to this which may not be possible possible to discuss in detail here, but the Cransley Hospice increase in number of staff leaving because of the uncertainty of the lease position does strike me that that is something we, there's a risk of that sort of being exacerbated. I don't know whether we can provide any assurance about the timescales around getting some degree more certainty, at least, about the current lease. Richard?
Yeah, do you want me to respond to that? So Julie, myself and HR representative met with all the staff a couple of weeks ago, a week ago, just to update and allow opportunity for questions. The lease discussion is with the estates and legal advisors at the moment, so they're going through the process and obviously kind of applying appropriate review through that, and that always just seems to take a bit of time. So that's where we are currently.
Thank you, Richard. Really helpful to know that you've undertaken that meeting. I think that sounds like an important step. Okay, so I think we're asked to support the recommendations. Probably from a board perspective, these are sort of, these are things that, unless anyone's got any objection, I think are things that are probably best left to the experts who've undertaken the reviews, but I'm sure that we would support the work that's been undertaken to do the establishment reviews. So Julie, if you're happy, we can just acknowledge that and leave you to take that forward. Great, thank you very much. So as ever, a useful report. So we move on then to the finance and performance section of our agenda today. So first and foremost, the assurance report from the audit committee, which is paper O, and in Sakib's absence, Melanie as deputy, we'll just take the opportunity to highlight anything, Melanie.
Thank you. Yes. You'll note from the report there are two areas with an amber assessment assurance level. One really just because of on the agile working, just a note that some of the recommendations in the audit report were not taken forward as they were deemed to be already covered by other workplace and workforce policies and practices already under covering other parts of the HR process and documentation. So something that may seem a little unusual, not often that we come across this in our audit reports, but deemed to be acceptable in this occasion. And then the internal controls assurance report, just noting a number of competing priorities and the change in the HMFA so that was I think that should be HFMA actually, that the changes in that were noted, and that there was going to be some change to the audit schedule in order to accommodate that additional work. But generally speaking, nothing else that I wanted to raise specifically.
Thank you, Melanie. Any questions regarding the content of the report? I thought it was just good to note that there had been an assurance review on our equality, diversity and inclusion, which provided substantial assurance. I thought that was positive to note. So always like to acknowledge the good as well as some of the outstanding issues. But thank you, Melanie. Okay, so we move on then to the Performance Committee Assurance Report, paper P. Back to you on that, Scott.
Yeah, thank you, Krishni. So a few points to bring forward. First of all, talk about some of the reports and also some of the sort of more strategic aspects of performance discussions that we got into in the meeting. So Dave was good enough to bring forward an ICANN report, which came at a time when we're obviously sort of trying to bed in the successes that we've had from ICANN as we move beyond the stage of having a consultancy partner Newton Europe, who are about to move on, and we've just felt it was important that we did that. And I think it was a really valuable session for Dave just to be able to bring forward all of the areas and the undeniable progress I think we've made in relation to ICANN and successes it's delivered. Jean referenced that herself in some of the conversation she was making, and naturally it led us into some conversation about things like the independent recovery bed. So a really positive discussion, and I think well received. Gareth brought forward also some views of both an ICS and NHFT level digital strategy updates, which I thought was particularly valuable. There was quite a lot of interaction in the meeting in relation to that, and some enthusiasm about how those aspects will be moving forward. And also Paul brought to us a sort of two-stage approach to the estates activity, so a sort of medium-term estates plan, and then also the sort of more medium term, first of all, sort of plan for a plan to deliver the refreshed estate strategy. And I think we've all received that with quite a degree of enthusiasm around the enablers that we feel that we can get out of that. From a more sort of pure performance perspective, we spent quite a bit of time looking at some of the challenges that we have in relation to IAPT. I know that there's a deep dive planned in that area, and also some discussion around it, both MSK and children's ADHD, which Julia brought forward earlier on and remains a sort of focal point and some focus of some escalation out of the trust at an ICS level. I also wanted to mention some sort of well, positive in the first instance, right, in relation to the reduction in year-on-year and in-month agency spend. Continues to be a challenging area. It's considerably ahead of where we would want it to be year to date, and the successes that we have, whilst they're not going to bring us back on target for that area for the year, I think are notable because they really do buck a national trend, and whilst it's it's not a comfortable environment for us at the moment, I think it's important to recognise the successes that we're having in that area and thank people for their focus on it. And I think you won't be surprised to hear, Krishna, that we sort of finished the meeting with a focus upon our ongoing financial position and the challenges that relate to that. And I know that we've recently taken some reporting materials back to governors at the last COG in relation to that. So I won't bring out the specifics of it, but suffice to say that that's been marked as a red in the report and that it continues to be a big focus area. I suppose a brief comment I should make, Krishna, even though he's not here at present, Saqib was good enough to take that presentation slot at the recent COG for me, and I just wanted to register my thanks to him for doing that. That was what I wanted to bring forward, Krishna, but I'm obviously happy to answer any questions.
Thank you very much, Scott. Any questions or comments on the report, or any aspects of what Scott has reported? Just a couple of things I just wanted to add, really, rather than I thought it was good to note that we talked about the strategy. I'm assuming we were referencing the digital strategy being shared with governors, so we'll need to build that into our into our forward plan. I think that would be really positive to do. So I just wanted to highlight that. And you mentioned the IAPT performance, Scott, and actually, again, I just wanted to mention something that Richard and I have planned, Richard Smith and I planned, which was actually to get, so Nikki Bishop, I think, is going to talk to a governor session about IAPT and a conversation about how perhaps governors can use the power of their networks to really, promote IAPT to our community. So we're going to have that conversation in December, I think. So I'm hoping that will be powerful. So I think that's worth noting. I just wanted to note the work on agency, actually, because we acknowledge that continues to be a challenge, but the agency spend position improving is a positive thing to note as well, albeit continuing challenge. So thank you, Scott. If there's no other comments or questions, I think we then move on to the integrated performance report, which is paper Q. Over to you, Dave.
Thanks, Krishna, and thanks, Scott. I think most of the big ticket items have been covered in some of what Scott and indeed you, Krishna, have referred to. I'll just draw your eye to a few good news stories. I think it's good that we're seeing our mandatory training now above 90%, and continued efforts at a divisional and business unit level to make sure consistently we've got that across the board. So that's an ongoing piece of work, and it's very challenging, of course, for people when they're juggling day jobs and so on. So we're also looking in our kind of staff experience group about whether there might be some economies of scale with partnering up with organisations that are delivering hands-on mandatory training that we could partner with, and thus we have a greater scope to introduce people to that training. And that's something that Julie's going to pursue through some of her networks, but more on that should it yield results. I'm going to come back to sickness overall just when I talk about IAP briefly, because I think there might be something for us just to link to Kenley's conversation about employment, just to cite the board really on some of the work we're doing or the thinking that's developing in that space. In terms of services then, we are seeing general shoots of recovery or improvements across some of our areas that we've been concerned about. Scott referenced some of the system work we're doing on children's services, and I particularly want to draw your eye to the continued sustained 2-hour response from our ICT services, and that's really important as we go into winter and as we deal with pressured acute services, that our services are continue to go above and beyond to try and manage need at a community level before it presents at hospital. So that's just a really critical part of our contribution as a system partner, and indeed great outcomes for our patients, because we're better to be looked after than their own homes. And the final bit just on performance is out of area, which links to some of the pressured finance discussions we've had, and there's a significant programme of work now within Anne's directorate and Rackham's directorate to try and see whether we can mitigate out of area placements, either through looking at our length of stay, but also developing admission avoidance, going above and beyond some of the admission avoidance processes we have in place through our crisis cafes, crisis hubs, ambulance cars, and so on. So that is a major piece of work, and quite important, I think, that we go as far as we can with that over the next few months, because it does form part of our financial performance too. And just to finish then on IAPT, welcome that the governors will join us in trying to ensure our residents are aware of this service and can access it. We are seeing quite a significant marked increase in long-term sickness in the East Midlands. It's risen by as much as 21% for those that are tracking some of this in the news. And that, when we look at the evidence for that, it would seem to be that a lot of the sectors that are driving that sickness relate to sectors that are prominent in the East Midlands: warehouses, distribution networks, freight, so on and so forth. Health is fourth on that list, by the way, just to illustrate some of the pressures our staff are under. And we think that when we know quite a significant number of those long-term sick, that has quite an economic burden, which we can see through the autumn statement, but also has a big impact on our mental health services, because about 65% are off with long-term mental health needs. The highest number are off for mental health conditions. So our prediction is that increasingly IAPT will become more and more important as part of the solution to the system and to the wider economy in employment. So that, along with our individual placement scheme, will become a major focus, I think, over the next 2 quarters as we respond to some of those issues. And I know the team are looking at innovative ways of joining up with employers and with Job Centre Plus and so on, so that we can embed that support at the point of need to support people to get back into work or to keep employment where it might be at risk. And that was one of the founding principles of IAPT. So it's coming back to the fore now, and we'll keep you updated with progress on that. So I'll finish there with just accordingly due thanks to teams for all they're doing and maintaining what seems to be steady and reasonable performance in quite pressured times. So thanks again.
Thank you, Dave. That was very comprehensive. Melanie.
Yes, I realise this might be spinning off at a bit of a tangent, so not necessarily something that Dave might want to answer now, but recognising your focus on IAPT and your and the really important focus on the number of people out of work. Also noticeable in the news is the reference to all the musculoskeletal reasons why people are out of work, and therefore at some point I think it would be interesting to understand how the trust is reflecting on augmenting, addressing the musculoskeletal resources and support that we have for people and patients, in addition to the IAPT elements. So maybe just something we could consider in an appropriate forum over the next period.
Dave, do you want to comment on that now? Or,
no, I think the point is well made and noted. I mean, I think we need to look at all of the evidence that's coming out from the ONS on long-term sickness and think as a trust, what are we doing to support people in those areas, both from a population perspective, but from our own teams. So yeah, welcome that.
Thanks, Dave. Couple more questions then. Judith and then Julia.
Thank you, Krishni. David, thanks very much for the report. I've got two small questions. One was in relation to the comment that there's an impact of data issues on the waiting list data that we're reporting. I was wondering if we have any understanding in advance of how this is going, how clearing the data issues up will impact on the waiting list performance. Is it going to be better or worse, or is it going to impact on something else entirely? And perhaps also time and when we're expecting to finish the project. And the second question was a data question in respect to the KPI analysis that is in the report, the SPC analysis. Some of these stats, for instance, the KPI analysis for children and young people referrals, the lower process limit is in minus numbers, and I'm just wondering from a statistical point of view how that can happen.
I'm going to have a deep think about the second question, and maybe my colleagues rescue me. In terms of the first one, I think the waiting list, we've got a significant program of work, and indeed some people on the job full time looking at our waiting list management. I guess from our perspective, my perspective, the process around safety netting within those waiting lists is quite important, and the numbers are growing incrementally each month, as you can see. So for me, the safety netting is the most important element to make sure that people are identified and flagged according to their needs and then escalated onto services accordingly. But I'll bring Jean in because I know she's supporting Janisa with that work.
Yeah, so there's thank you. There's quite a lot of work that needs to be done in terms of data quality, and it's actually one of the reasons we put in a data validation team probably about 18 months ago. So we saw a significant improvement in the data. What we've done now, what we've identified is a number of things that need to be amended in order to prevent the data quality issues reoccurring. And I had a really great conversation with colleagues in DTS, particularly around clinical systems, and some of the changes that we need to make to the clinical systems, which would support the data mapping over, which will make our data much better. So it's quite an extensive amount of work that's still to be done. You do, and I think this would just be an ongoing piece. I don't think we're ever going to get to the point where we can say actually all our data is perfect, but we certainly are hoping to see significant improvements over the next 12 months.
Thank you.
And on the statistical possibilities with the minus, I'm going to have to take that away. You did come back to you with a response. Thank you.
Thanks, Dave. I think it's just looking at it, the report. I think it's particularly around EDs and eating disorders. So that seems to be the lower. That's where the lower process limit looks strange.
Yeah, we'll get just to get it right rather than making it up on the spot.
Yeah,
patch it together. I'll get something written to you, Judith.
Thank you. Maybe Dave, you could include that in the report back in January, so we kind of understand what change, if any, has been made to that. Julia.
Thanks, Chrissy. So just to go back to Melanie's point about MSK issues, and just to say that very helpfully she brought up at the Quality and Safety Committee a few weeks ago, as part of our risk review around G3, one of our strategic risks around staff wellbeing, and we had a really good conversation about staff and the effects of MSK disorders on staff sickness. And we just agreed this morning in our agenda setting session that at the next meeting in December, we will actually follow that that through and have some more information around that, so that we can have a good look at that and see the impact and track that as part of that risk. So thanks, Melanie, for that. That's great.
Thank you. Always good to be responsive to these issues quickly. So that's great. Thank you, Julia, for confirming that. Okay, so clearly, you know, I think we know that the report reflects some of the clear challenges we are dealing with at the moment. But good to see the work that's been done in sort of refining the reporting, which I know we've welcomed in the past, and we'll leave, Dave, as we've said, a couple of things just to clarify going forward. Okay, thank you very much. So we move on then to the assurance section of our agenda. So we have 3 items to cover. The first of which is the Leicester Partnership and NHFT highlight report. Welcome, David, who, as I advised, was not with us at the start of the meeting. David, anything you particularly wanted to highlight from this report? And I think there is a couple of things we need to note regarding the effectiveness of the joint working group as well. So over to you.
Absolutely, thank you. Thanks, Krishni. So a couple of bits to highlight are in the analysis section. So the group's strategic framework is a conversation that we're working through the refresh and the redevelopment. And members of the board will be fully aware that we spent some time together on Monday doing both our Together Against Racism and then also spending some time looking at the strategic framework. And I thought it was just reminding ourselves that we've said we'll work together as a group on the things that deliver economies of scale, that share strategic advantage, that enable us to share good practice or provide mutual aid and learn from each other. So they're the things that are feeding through into our strategic framework. And so some of the stuff that's developing and emerging through there are the things that get highlighted in the kind of the amber risks in the highlight report. Anchor institutions and social value are a key priority for us in a way of working things through. And we spent some time in NHFT with the senior leadership team exploring social value on Monday. And that will develop into further work and a programme of work where we can evidence our social value. I think there's an awful lot that in NHFT we're doing day in, day out, but a greater requirement for us to know what we're doing, identify any gaps, and then plan for the future. I think the other bits there, value-based healthcare, Paul, as our Chief Finance Officer, is really looking at the ways we can develop and move things forward. And as I touched on, we had a board-to-board with LPT on Monday and want to follow that up with another board-to-board, probably January is what we're looking at, early 2023, in order to take things through. So I think they're the key bits in the analysis review. In terms of updating around the effectiveness review, we've included that detail in the paper and the recommendations that are through there. So Appendix B includes that. Just ask people to note that that's there. And generally overall, we've been progressing in the objectives that we've set ourselves. So I hope people will note that and support that as well.
Thank you, David. Thank you. I think the key focus is, as you know, I co-chair the group with Cathy Ellis, and Julia has recently joined the group, replacing Maria, who was the NED representative in the group. And I think the key thing we always try and focus on is the sort of how we're going to add value to something as a group. So we're really trying to keep our focus on that rather than get too operationally focused, really. So some of the things that we've I know colleagues will now have sort of talked through, it's where there are opportunities for us to do something together that really adds value, and that's certainly been the focus. So Julie, do you want to come in?
Yeah, I was just going to come in on the analysis for it's in table 1 around quality. The quality improvement, some of them are down to LPT and not just about us. So the knowledge hub and the business case is to do with LPT. I just wanted to be clear, but we've got a really good working group now across the 2 organisations looking at quality improvement at the group level, and it's now monthly and it's quite a strong group.
Thank you, Julie. So if there are no further comments or questions, I think important to note that, sorry, David.
It's all right. We both might be about to do the same bit. Was attached also as the updated terms of reference. So yeah, fine. But we are both trying to do the same bit. Sorry, I'll be quiet.
So I think, yeah, so we just need to make sure we're actually comfortable. The effectiveness review concluded some changes to the MOU and terms of reference, so we just need to support those. And actually, just one point of note, Richard, we need to pick up with Kate, I think, because obviously this is these are joint documents. We need to note the change from Julia, from Maria to Julia, because Maria's mentioned in the documents. Yeah, Judith's noted that as well. So we need to make that change. Otherwise, are we happy to sign that off? Everyone okay with that? Thumbs up? Yeah, good. Okay, thank you very much. And just really wanted to commend the team who put together the Together Against Racism initiative and event that we enjoyed together on Monday, because that was really powerful and really good to work together on that. It was challenging, insightful, thought-provoking, and all those other things. So really good. Thank you. Okay, so we move on then to paper S, which is really the conclusion of the board and committee effectiveness reviews. Not to say there aren't some actions that we still need to take forward, but I think it pulls together the report on the things that we've agreed. So is this over to you, Chris?
Yeah, I'll just very quickly, Krishni, obviously this is the annual effectiveness review in line with the approach that we've historically taken, and the feedback was fairly consistently a high level of satisfaction. And then I think it really is just the headlines of the changes we've got, which are listed, such as the level 2 commissioning, collaborative strategic workforce, strengthening the reporting model, reconfirming our joint committee approach and how we take that forward, stimulating engagement with the system leaders, streamlining the workforce plans, and the review of the reporting format, which we discussed at some length. So it's just to ask the board to receive the outcomes and endorse the proposed actions.
Thank you, Chris. So obviously these have been extensive discussions in our board development sessions where we've sort of debated a number of the ideas for development. I think the key action to take forward is the development of the terms of reference around the joint committee and indeed the name of it and all of those other things. So I think that's a key action, isn't it? Yeah. And I think on the template, the only other comment I wanted to make was just about making sure that we reflect the needs of the new code of governance for NHS providers, which is obviously now coming into effect, and that includes demonstrating the system impact element that is sort of now very much a part of that code of governance. So there's something about just even in simple terms, just adding it to our governance table. I think that we've considered system impact in some of our decision making. So there's a few things like that, but I think it's been a really good process, I feel, and I think there's been some really good developments from that. Trust the board is happy to support the actions that are set out. Great. Do we have a sense of when we think, are we looking to repurpose, inverted commas, because it's maybe refresh the terms of reference and the joint committee by the time we start the new corporate year? Looking at Chris and Richard, would that be the plan? So we're good to go in
definitely
April?
by then, Krishni. We'll probably be on it quicker than that, but definitely by then.
Okay. Richard, do you want to come in?
Yeah, I was just quickly going to confirm that the plan is to present some terms of reference to hopefully the January meeting of the board, as you say, so that we're then in a position to start the new year with a new approach. Thank you.
Great. Thank you very much. Thank you. Thank you, Chris and Richard. And can I take this opportunity just to recognise that actually Richard has stepped into the shoes of Fiona Barr, who's departed. So congratulations to Richard on in the role on an interim basis, and that really I know the board will be looking forward to working with Richard in this. We work with Richard a lot, and we enjoy working with Richard anyway, but it's nice to recognise that it's in a slightly different capacity. So well done, Richard.
Thank you.
Okay, so we move on then finally to our healthcare workers flu vaccination checklist. This is an important update that we're required to receive into the board, and it's over to you, Julie.
Thank you, Chair. So this is our annual update that, in line with the National Flu Letter, we are asked to present to board. I'm going to take the paper as read. While we've been in board today, we've received updated compliance figures. So we have two sets of compliance figures against the target. We have our internal, and we don't have access to the databases that we had access to last year through COVID and the year before. And if people have their vaccinations, flu vaccinations or COVID vaccinations outside of the trust, we rely on staff self-reporting through a little app-looking thing that's on every computer in the trust. It's got an MS Teams form in the background. So we have different data to the regional data. So we get regional data as well, which is what's coming today. And I just wanted to say that the regional data as of the 20th of November says our compliance is 41.7%. I've also looked at the COVID data. I know this is a flu report, but obviously COVID vaccines are important as well. You know, it's all about patient safety, carers' safety, our families and our own safety. That's why we have these vaccinations. And COVID on the regional data as of today is it's the 20th of November, is 37.5%. So we are reporting both sets of data going forward. So our internal data is slightly different from the regional data, but we don't provide our data to regions, so they're obviously getting it from one of the national bases, we assume. So I wasn't going to bring up anything else. That's where we are. We continue for comms campaigns. As you will see, we've got a mixture of backgrounds up today, and this is part of our campaigns, and we are asking staff, and there will be text messaging coming out shortly about recording on the little app if they've had their vaccines.
Thank you, Julie. So actually, Julie, the figure that's being reported regionally through or nationally or through the data that you've received, the official data you've received, is actually higher than the data that we have collated locally.
Yes.
Okay.
Because we rely on people self-reporting if they've not had it in the trust, and obviously we offer flu in the trust, but a lot of people go externally, and all our COVID vaccines are external to the trust.
Okay, thank you. So are there any comments or questions on this report? I think, I mean, clearly Judith and Julie are, in fact, AJ as well, are using the promotional background to encourage people to take their vaccinations, and I think we have all had them, and I have certainly used mine on occasion as well. It's really important. Thank you to the board for making sure we appropriately role model this, because it is important that we demonstrate this. And I know that when we were, for those of us who received it whilst we were in a, I think, board development session, I think there were photos published on Twitter and whatever to show our commitment to this. So we do need to take the opportunity to promote this at every turn and encourage people to take it up. And if there's anything else, Julie, that we can do as a board to support the campaign, do bring that to our attention. But certainly on a personal level, I think it was important to say that found the self-reporting app incredibly easy to use. I think Julia commented on that as well. So so well done to whoever came up with that idea, although it is strange, isn't it, to have a slightly different reporting number from a different source, but we are where we are with that. Okay, so and what's the deadline for us to achieve the target, Julie? Just remind me.
The flu campaign actually comes to the end of March next year.
Okay.
However, we usually find quite a drop off. It usually, you know, February time, but actually the campaign runs to the end of March next year.
Okay, so we need to keep promoting the take up clearly in the meantime. So anything we can all do on that, I'm sure we will. So thank you very much for that report back, Julie, on where we are, and thanks again to colleagues who've made sure that we've done our bit to promote that so far. Okay, we move on then. I think we've dealt with all our main business. We do now have just the declaration of interest register paper U, which just remind colleagues to keep up to date and make sure that so that when we report that to the next meeting, I think we probably just need to note that I think Fiona might still be on that, and obviously that will need to be updated. I don't think I have any other business. Just check that there isn't anything else that people want to raise that we haven't covered off. Okay, Maria wants to come in, but before I bring her in, I also wanted to say it is Maria's last meeting. I think I mentioned that at the beginning. So I just really wanted to say, I think, take the opportunity today. I know Maria actually doesn't leave until technically the end of the year, but this is Maria's last board meeting, and it's important to recognise the great work she's done as a non-executive. She's done a huge amount of work supporting, I know, you know, collaboratives and system working. She's also been our deputy chair. No, Julie has very ably stepped into those shoes now, but I know everyone's going to miss her. So I really just wanted to, in public, thank her on behalf of the board for the contribution she's made. She's going to be absolutely, well, I'm sure she already is absolutely fantastic in the new role she's got at the ICB. But congratulations, Maria, on that. And thank you very much for everything you've contributed to the trust. I think it's been a really brilliant journey that we've gone on with your support. So maybe a round of applause, and then Maria, you don't have to have a speech, but if you wanted to say something, obviously you're most welcome to.
Thanks, Krishni. I put my hand up because I just wanted to say thank you to everyone on the board. I feel really privileged and lucky to have been able to work with Team NHFT as a non-executive director. I've learned so much from you all, and always so impressed and in awe of the work that you all do and the commitment that you have to the residents in Northamptonshire and the patients you serve. I thank you to everyone on the board for putting up with me and for supporting me and listening. I've always felt listened to. I've always felt that I can make a contribution in meetings and hopefully make a contribution to the work of the trust. And I just wish you all the very best for the future. I'll carry on supporting you from the sidelines and watching everything you do. And I know you're going to go on from strength to strength always. So all the best from me, and thank you so much for letting me be part of your team.
Oh, thank you, Maria. That was really lovely. And, you know, thank you for your thanks. But I think, you know, really important part of the team. And we're not quite letting her go yet because she's got performance and quality to do in December. But, you know, it is a public board, and it's important to recognise the journey we've been on together, Maria. So thank you so much. So with that, I think I can just conclude by asking if colleagues have got any feedback around the board. I think this is probably the earliest we've finished the public board in a while, so we've been quite sharp, even though we've had a fair amount of content to cover. But if there is any feedback, now is the moment. Otherwise, I'm happy. I think we should reward ourselves by giving ourselves a slightly longer break and I think probably start our private meeting at 1 o'clock as planned, because I usually know colleagues will work around those times. So is there anything anyone wants to comment on before I close the meeting? Okay. Well, thank you to members of the public and particularly governors who have observed the board. Thank you everyone for contributions, and I'll close the meeting now. Look forward to you joining our private meeting at 1 o'clock. Thank you.